about to see Natalie. What can you tell me about her today?
So Natalie is a 30-year-old female, G3P2. She's currently 30 weeks pregnant, and she's referred to the outpatient physiotherapist by her midwife for lower back pain. The lower back pain's been present since her cesarean 18 months ago, and she's got anemia, she's got gestational hypertension. Her referral also states that she is due for a elective cesarean at 37 weeks due to her gestational hypertension. She's also on Xray, which is an iron tablet, and she's also taking Elevit, which is a pregnancy multivitamin. She's working still, but it doesn't say what she's doing, so I want to ask her more about what she's doing. I also wanted to ask her about her bowels, because I looked at symptoms of Xray, and I know that it can have a bit of an effect on her, on the patient's bowels, abdominal pain, constipation, stuff like that. So I want to ask if that's anything to do with the gastrointestinal tract is affected. Yeah.
Great. So what do you want to do today?
So I want to get a clearer idea of where the pain is, if there's any incident that caused the pain, her history, severity of the pain, what the nature of the pain is, what makes it worse, and what eases the pain. Also a 24-hour picture and irritability. If she's had any treatment for her pain before, what she did, if it helped at all, and her birthing history. I want to look into that. Any special questions, if she has any pins and needles, or numbness, weakness, heaviness, cord or cauda equina signs. If she's had any previous medical history that could play into that, any previous medication. I want to know more about her social situation, whether she's living with anyone else, and if she has any other children. I want to know whether we can find anything to support her at home, and it's exercise and hobbies, if she's doing anything else apart from work, to check her physical status. And it's a bit hard to predict what I want to check objectively, because that could depend what we find subjectively. I'll definitely look at her posture, her gait, and I'll palpate around the pain and check her lumbar range of motion and balance. If she has any neurological symptoms, and if the pain extends any further than her hips, then I'll definitely complete a neuro assessment, and I'll also check her thoracic spine and hips as well.
Great. So how would you clear the SIJ?
I'll do a standing forward flexion test. I'll also do the Gillette's or modified stock test in standing, and I could also get them lying down supine as well. I'll try the posterior pelvic provocation test, distraction and compression of SIJ. I'll also check the active straight leg raise as well.
Great. So what time are you seeing her today?
So Natalie's appointment is at 10:30.
All right then.
Hi Natalie, I'm Emily. I'm a final year physiotherapy student, and this is my educator Anna.
Hi Natalie.
Hello, how are you?
So you've come in today because your midwife referred you to us. Can you tell me why?
Yeah, I've been getting a lot of back pain, and
Okay.
so my midwife thought it'd be a good idea to come and see you guys.
Okay.
So hopefully I can keep working up to about 35 weeks if I can.
Okay, Natalie, I will be going through quite a few questions, so if at any time throughout the assessment that you feel uncomfortable or you're feeling any increased pain, do let me know so we can alter things for your comfort. Okay.
Thanks, appreciate it.
No worries. So I want to know a little bit more about your pain. So where do you feel it? Can you point to it?
Yeah, it's like a deep pain over
Okay.
here.
Yep.
Yeah, but it's sort of tended to touch
Okay.
over here as well.
No worries.
Yeah. I first started getting the pain after I had my son. He was a cesarean, and then it got better.
Mhm.
But then it started again with this pregnancy. Probably when I was about 20 weeks pregnant. Yeah, when I had my 20-week scan.
Okay. Okay. Great. So it was around that area.
Yeah.
Can you tell me whether it goes down your leg or up your back at all?
It doesn't go down my leg, but yeah, sometimes it goes up my back, up the side here.
Okay.
Yeah.
How would you describe that pain? Is it sharp? Is it dull? Like a stabbing or shooting?
It's like a really deep ache.
Okay, deep ache. Okay, and let's say on a scale of 0 to 10, 0 being the worst, no pain at all, and 10 being the worst pain, where would you put yourself at this moment right now?
Right now, probably about a 2.
About a 2, okay. And can you tell me the worst pain that it can get to on that scale, same scale?
Probably up to about a 7.
To a 7, okay. And so what aggravates that? What gets it to a 7?
When I've been on my feet and walking a lot,
Okay.
or walking up and down a lot of stairs, and sitting for too long as well. Getting in and out of the car is quite difficult as well.
Okay, yeah. Can you tell me how long it would take? So when you're standing, how long will it take for you to start feeling that pain?
Probably after about 15 minutes.
15 minutes,
I'd say,
okay.
yeah.
And what about climbing the stairs or sitting?
After I've taken maybe 3 or 4 stairs, I start to feel it, certainly by the time I get to the top of a flight of stairs.
Okay.
Yeah, and I can sit for a little while, but probably after half an hour I'm certainly uncomfortable.
Okay. Okay, can you tell me if there's anything that relieves the pain for you?
Rest and hot showers, hot packs. Sometimes I just kind of do some little movements like this
Okay.
and stretch it out and it's comfortable.
Right. And how long would you say it takes for that pain to settle down?
I think it depends on how bad it's been. If it was sort of up at that 7 out of 10, definitely I need a few minutes at least, a little while to just sit down and have a rest, and it might go back down to sort of that achy 2 out of 10.
Okay.
Yeah.
And what's your pain at its best?
Well, sometimes I have no pain.
Okay.
Yeah.
Can you tell me a little bit more about that? Like, can you remember any specific times when you've had no pain at all?
There've been a restful day when I haven't had to
Okay.
be on my feet or lift up my toddler too much.
Okay. So no activities.
It's
That's
better.
for you.
Yeah.
And walk me through how your pain is in the morning, like when you first wake up. What's that like for you?
I feel pretty stiff in the morning, and when I first get up, sometimes I get like a sharp catching pain, which can be very uncomfortable when I'm standing or first take some steps. And then during the day, depending on what I'm doing, it can get aggravated, especially when I'm at work. And at the end of the day, if I've been at work that day, it gets pretty bad by then.
Okay. And what about at night time? Like, do you have a position that you favour more? So what's that like for you?
Well, I can't sleep on my tummy anymore, so I just choose to sleep on either side. But sometimes it can be hard to get comfortable, and moving over from side will wake me up, usually 2 or 3 times a night.
So are you doing anything that causes you to wake up during the night?
It's with movement, like when I roll over and try to reposition,
Okay.
yeah, I get like a sharp pain in here.
So Natalie, do you use any pillows between your knees?
No, I don't.
No? Okay. I do know that a lot of pregnant women prefer to use 1 or 2 pillows between their knees when they're sleeping on their side. So you could give it a go, it's up to you.
Yeah, okay, I'll try that.
Okay, great. I also want to know if you're getting any pins and needles, any numbness, weakness, or if your leg feels heavy at all.
No, not pins and needles or numbness.
Nothing
No.
like that? Okay.
Sometimes a bit heavy, but yeah.
Okay,
Yeah.
okay. So Natalie, are you having any changes in sensation around the area where you wipe after going to the bathroom? No? Okay, so that's fine. Are you having any difficulties going to the bathroom or controlling any bowel movements?
No, I go to the toilet a lot to do a wee.
Okay.
And sometimes I find I'm a little bit constipated, which didn't happen with the first two babies, but a little bit now.
Okay, can you tell me how often you do urinate?
Ooh, well, I've already been at least 4 times this morning, and then I'll do that again this afternoon easy, so.
Okay. So are you on any medications at the moment, and are they different to your previous pregnancies?
Yes, I'm taking the iron tablets now, the Ferrograd C, which I didn't take before, and the multivitamins, the Elevit.
Okay. And I know that the iron tablets can be contributing to your constipation because it's one of the side effects. So to help with that, we need to make sure that you're drinking enough fluids, at least 2 litres of water a day, having your 2 serves of fruit and 5 serves of vegetables. And we can ask your GP as well what they recommend, maybe a safe stool softener for while you're pregnant. Yeah, you could ask your GP or the local pharmacy as well.
Yeah, because I think I eat pretty well, but maybe I don't drink enough. Yeah, I'll try that.
Yeah. So it's very common during pregnancy that you'll need to go to the toilet more often. It's because your baby is, growing, and it'll put more pressure on your bladder. So you'll feel like you'll need to go more often than usual. It's the same as you feel you can't eat as much as well.
Yeah, I felt it with my other 2 pregnancies as well. Yeah.
Do you ever feel that you might leak urine when you cough or sneeze, or you have to rush to the toilet?
No, I've never had any accidents. I've been lucky, and sometimes I feel like I have to go, but I can hold it while I get there.
Okay, yeah, it is common, and we want to make sure that we keep you safe for the future. We don't want you to have the problem, so we'll make sure that's fine.
That'll be good.
Yeah. You also mentioned that you're on Elevit and your iron tablets. Are you on any other medications?
No, just those.
Okay. And what about any other health issues like breathing, heart issues? Do you have any thyroid issues, blood pressure, epilepsy, diabetes, any recent infections or arthritis?
Well, apart from the anemia, I've got high blood pressure.
High blood pressure.
Yeah.
Okay.
So hopefully I can keep working until I'm 35 weeks. We'll see how we go.
Okay. And what do you do for work?
I work at that's mostly, and sometimes I'm in grocery.
Okay. So you're on your feet a lot.
Yeah, all day. Yeah.
Okay.
Yeah, it's quite repetitive.
Oh,
Yeah.
okay. Do you get any breaks during your shift?
No, I do. I get 2 10-minute breaks and an hour-long lunch, which is nice. I can sit down and have a rest then.
Okay. And what about lifting?
Nothing too heavy. When I'm in on the checkouts, it's just that repetitive work. But when I'm in grocery, they usually just put me somewhere where it's quite light, like in the health and beauty section. So
That's
too heavy.
good. That's good. So if I may ask, why do you feel like you need to keep working even after all the pain you get during work?
Oh, just financial gain. It will just put us in a better position, and I'm just working 3 days a week, so at least I get the chance to rest on the other days.
Okay, that's good. So how are you doing? You feeling okay?
Yes, thanks for checking in.
Okay. So you've mentioned that you've got 2 kids. Were they both cesareans?
Yeah. Zoe was an emergency cesarean. Heart rate was dropping, but then Noah was an elective, which is cesarean.
Okay. And how old are they now?
Zoe's 4 and Noah's 18 months.
Oh, lovely.
Yeah, so
Okay. Is there
very
anyone?
busy.
Yeah. So is there anyone else at home?
Yeah, my partner James.
Okay.
Yeah, he's very supportive, helps a lot with the kids.
Mm-hmm.
But sometimes I still have to pick up and carry Noah around. Oh,
Oh, wow. Okay.
Yeah.
And how much does Noah weigh?
12.5 kilos or so.
12 and a half.
Yeah.
Okay. And how often do you have to do that?
Every day.
Really? Okay.
If he's upset or picking up onto the change table.
And how would you carry him normally? Do you have a favourite position?
Yeah, I tend to hold him like on this right side,
Mhm.
which does sort of flare up the back pain.
Okay, so on your hip there.
Yeah.
Okay, so from what you've told me, your pain, it sounds like it's coming from your pelvis, and possibly your lower back as well. And this could be related to some of the things you do during the day. I would like to do some assessments on your back and pelvis to confirm that, so I can plan how to best deal with your pain.
Yeah, sure. Sounds good.
Okay, Natalie, so now what we're doing is we're just going to do some knee raises. So putting your weight on your left first and then lifting your right knee up, and then we're just going to swap it over to your left. And while you're doing that, I'm just going to be feeling around your back there. Okay, so let me know if you feel any pain, but I'll ask you during the process as well. So I'll just going to be pushing right here. Okay, so move your weight to the left and raise your right knee. Okay, back down. How did that feel?
That was okay.
That was okay? All right. We're just going to do the same. So weight on the right and raise your left. Yep. How was that?
Oh, it's a bit uncomfortable, bit of pain in here. Yeah.
Over there? Yeah. Okay. All right. So you're feeling a bit of pain there. That's fine. So we'll just, I'll put your shirt down now. Don't need to do that. Okay. I'll just raise the bed for you first. So I'm just going to have you lay down for me next. Yeah, you can take your shoes off. So I'll get you to sit first, and I do want you to lie down, but before you do, I want you to lay on your left side first, so then you can roll over once you've lain down on your left. So try to use your elbow for support. So yeah, lean down on your left first, and then roll over. Is that too high?
Yeah.
Yeah, I'll get that off for you. Okay, that's good. All right. Okay, Natalie, so you're going to be laying down for quite a while, so let me know if throughout the examination you feel any dizziness or shortness of breath. Okay, and if you feel any pain, do let me know. So I'll get your legs straight first. So both of them down. And I'm just going to start with some leg raises, and you're just going to try to lift your left leg up and try to reach my hand there. Yeah, awesome. How did that feel?
That's okay.
That's okay? Great. Okay, just going over to the other side. We'll do the same on this side. So just try to reach my right hand there. Okay, how was that?
No, it feels a bit heavier.
Heavier?
Yeah, it's some pain as well.
Okay, can you
Yeah.
rate that out of a 10?
Maybe like a 4.
A 4, okay. Alright, I'll try to get, so what I want to get you to do is draw in these abdominal muscles while you're doing the same thing. So just along here, you'll feel that tension there. So I'm going to press down here so you can feel it. And we're going to do the same thing, so just try to reach your right leg up. Okay. Was that any different to before?
Yeah, my leg felt a bit lighter and it was a bit less pain, probably
Bit
like
less.
like a 3 or something if I was going to give it a number.
Okay, great. Okay. All right. So now what I want to do is put some pressure here. So I want to see if that stabilizes a little bit better and supports you. So I'm just going to put some pressure on here, and we'll do the same thing. So just try to lift your right leg up a bit. Yep, there we go. All right. And did that feel any different to the previous
Yeah,
one?
it actually did. It felt lighter and it still hurt a little bit, but not as much.
Okay.
Probably
And what would you number that one?
probably a 2.
A 2. Okay. All right, so that's a bit better. I'm going to go around the other side again. Okay, how are you feeling? All right? Okay.
Yes, thanks.
All right, so I'm going to lift your left leg up again. And I'm just going to put some pressure down here while putting my hand behind here. Okay. All right. Just going to push down. Okay, how does that feel?
That's okay.
That's good. All right. Okay, I'll put that down. Alright, so same on the other side. I'm going to lift this leg. And I'll put my hand around here again. And just going to push. Oh, okay, you don't like that?
Yeah, no.
So that's painful.
That's really sore.
Okay, can you give that one a number?
Oh, that's like a 7. Yeah, that's like the pain I get. I've been standing for too long.
Okay, so we'll let that one settle down.
Okay, Emily, so what did you find out on your assessment?
Okay, so from the subjective, Natalie reports an intermittent deep ache through her right lower back and over her right SIJ. This is aggravated by standing for 15 minutes or more, climbing stairs. It will start after a few steps and it'll get worse by a complete flight of stairs, and carrying her 18-month son, who weighs 12.5 kilos. She carries him on the hip. She reports an ache throughout her right lower back after sitting for 30 minutes, and she feels stiff in the morning but settles once she's been up and moving around, and finds her pain usually gets worse over the day if she's been at work. She reports she can get some improvement with pelvic tilts. She massages through her right buttock. She has hot showers and heat packs. And she's still working at the checkouts, filling shelves 3 days a week. And she lives with her partner and 4-year-old daughter and 18th-month son. So this pregnancy, she's also been having some constipation, which is not normal for her. Objectively, she has had an increased lumbar lordosis and right ASIS, rested lower compared to left, reduced gluteal muscle activation on the right compared to the left, and I did notice she tends to shift her weight to the left side a lot. She was tender on palpation through the right PSIS, which I think is likely to be long dorsal ligament. She has reduced range through flexion with no pain and slight pain on the right with right lateral flexion. But it's difficult to flex that area when her abdomen is large from pregnancy, which may also explain the stiffness and mild tenderness through her L3 to 5 on the right. So she's got pain through the right buttock as well after stepping onto her right leg after 3 steps up. She has a positive Gillette's bilaterally positive P4 test on right and positive active straight leg raise with the right leg raise with improved symptoms with compression and improved pain through right buttock with TRA activation. And she was tender on palpation through her QL, glute med and piriformis, more on the right than her left. Yeah.
Great. So what would your preliminary diagnosis be now?
So lumbopelvic dysfunction, particularly with unilateral load bearing on the right. I think the right innominate might be anteriorly rotated, so the right SIJ might be unlocking.
Okay, and so now what's your treatment plan?
Well, I'm mindful of time. I've been given some basic advice for her constipation, but I would also like to give her more details about position for toileting. But I think I might plan to do that next time, as her main focus is trying to improve her pain today. I want to give her some education and reassurance about why this may have occurred because of the hormonal changes related with the relaxin during her pregnancy and relate this to her symptoms and functional limitations. I've already given some advice about rolling and getting in and out of bed. So when she practiced getting up from the plinth, but I would like to give advice about reducing unilateral loading, particularly I want to discuss how to take care of her back better, for lifting her toddler and changing positions maybe while she's carrying him. I want to relieve some of her symptoms today, so we'll start with gentle release of her QL, piriformis and glutes, and teach her self-release, piriformis stretch, and some pelvic tilting and circling as well. So once I've reassessed her movements and pain, would like to fit a pelvic belt to see if that helps her symptoms as well. Then I'd get her to manually activate her TRA and glutes when she stands up and steps off or through, as that's when she gets her pain. So next time, depending on her response to my treatment, I'd like to assess her lumbar stiffness more and include more pelvic tilting, lumbar mobility, because she found that really helpful. I could also include pelvic floor muscle activation when we discuss her back care and lifting more.
Great, sounds like a good plan. Let's go back in there.
Alright, Natalie, so the last thing we're going to do is put this belt around you. So it's just going to come around here. It's going to be similar to how I placed my hands around your pelvis to support that. Did that help you before?
Yeah, that
Yeah.
felt good.
So it's similar to that. It's just going to support your pelvis, so when you're moving around, it helps support that better. So I'll just get you to stand up for me. So I'll put this around. So I'm just going to place it around here. Alright. So just going to pull it around and okay, how does that feel there?
Yeah, that feels
Good. Okay. Okay, so we also have these two straps on the side. So I'm just going to get rid of these. So what we're going to do with these, I'm just going to pull a bit firmly but not too hard. So I'm going to put equal amount of pressure and just going to brace yourself while I do that. Okay, so just doing that. Okay, how does that feel? So not too tight, but it
No, that's
provides some
comfortable.
support. So I just want to check with that, like the exercise we did before when you raised your left knee up. Just want to check how that feels for you. Okay. Does that feel better?
Yeah, it feels better than before.
Different than before? Okay.
Yeah.
Also we'll try to get you to put it on yourself as well. So we'll take this off and I'll get you to put this on yourself as well. So just so you have some practice, I'll get you to put it on yourself. Like this. Yep, just a little bit lower, that's good. Yeah, and you just want to make sure that it's centered and make sure it feels just under the abdomen. Alright. Yeah. And you're just going to pull both of those together. Just firmly but not too tight. How does that feel for you?
Yeah, it's a nice comfortable squish.
Alright, awesome. So yeah, so try to wear that while you're standing, on your feet, when you're working. It can readjust when you sit down, so make sure if it falls loose or anything, just take it off and redo it again. And yeah, hopefully that works out well for you.